Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper left edentulous areas and the lower right 8, the upper right 8, and the lower upper left 7. Now moving to the edentulous areas where implant placement has been indicated on the transaxial view, we can see that we don't have adequate bone in this region. We've got 5 millimeters of bone width with approximately just 5 millimeters of bone height. So a sinus lift procedure will definitely be needed to be done in the upper left for second premolar region. In the upper left molar region, we can also see that we've got very limited bone here, and here we've got approximately 5 millimeters of bone with approximately just 6.3 millimeters of bone height. So again, a sinus lift procedure is definitely indicated, and it's possible because we don't have any signs of sinusitis. On the upper left second molar region, we can see if this is second molar or the third molar, but it is root canal treated with glossary caries. The furcation is involved. You can see a radiolucency in the furcation area. We don't see major periapical radiolucency, but we do see significant bone loss around this tooth due to the furcation involved in this tooth. Moving to the top right 8, which is the upper right 8, a major periapical radiolucency can be seen. This is a grossly carious tooth with very widespread roots. We've got a parietal and we've got mesial and distal roots. You can also see that this is grossly carious with almost the furcation is involved. The parietal root seems to have resorption as well. So this tooth will have slight problems when extracting. On the bottom right molar, with the bottom right third molar, we can see there is also grossly carious with major periapical radiolucencies, and the furcation area is also very close to involvement here. You can see that there is significant bone loss. We've got PDL widening as well. On the axial view, we can show you that this is the upper right side, the upper left side. This is the ridge on the upper left. It's very short and thin in some areas. We don't see any major signs of sinusitis, just some sinusitis in the top right. But this sinusitis could be associated with a endodontically treated tooth, but is not necessarily associated with the wisdom teeth. On the bottom, we can see this is the bottom wisdom tooth on the bottom right side, glossally carious, and is not very close to the inferior alveolar nerve, so extraction should go uneventfully. There are 2 root canal treated teeth on the bottom right hand side, and these root canal treated teeth appear to be normal in their root canal treatments. They don't seem to be a missed canal. The upper right first molar also has all 4 of the canals have been obturated. This is the top left second molar, where we can see radiolucencies interradically as well.